Hello everyone, and welcome to this uh, this oh, this Storm Labostix production. This will be a Storm Labostix production as part of the Labonyx Bltztorm. This is as part of the editorial edition. This is a Bostix news, and part of a path slide and a cavalcade, part of a cavalcade, as part of the cavalcade sort of edition as well. So this overview will be in this the Labonyx Bltztorm sort of overview. Part of this overview will be in around looking at coping, and is this the foundation of well-being? This works was collaborative, originally presented research presented in 2010 at the Excellence in Pediatrics sort of conference retrospectively, and where the works was collaborative between researchers at an academic institution based in Scotland, in the United Kingdom. So a bit of background. So for several years there has been a sort of proliferation in coping research across for example, social and behavioural sciences, medicine, public health, and in and around nursing. A few authors have sort of strived to put forward understanding and perspectives in exploring such interactions through, for example, laboratory investigations. These explorations have been important because coping and stress research, for example, was once seen as almost a two-dimensional, when really coping should perhaps be viewed three or even four-dimensionally across specialties. And central to health and disease mechanisms must intertwine, especially in young people facing illnesses such as chronic kidney disease, or CKD. The objective of this work is and was to identify whether coping is actually the foundation behind well-being by exploring different models and theories. So in around sort of models and theories, then. First and foremost, one of the theories, one of the models and theories, is, for example, Hansen's general adaptation syndrome from 1936, and Hansen, who was primarily an endocrinologist, and sort of researcher, and where Hanseni looked at research where sorry looked at how physiologically, how from a physiological basis, how different in context in context of laboratory, of using laboratory sort of through laboratory investigations, seek to understand stress and how physiologically how stress is how stress sort of is pertained sort of physiologically. So what Seni did from early research was look at stressor, look at a trigger or in around stress or a stressor, and how that sort of had an impact or had a sort of impediment around the hypothalamus gland and the pituitary gland, and then how the adrenal glands were affected, and then from the adrenal glands, whether the stomach was affected, or whether thymus nodes, the thymus lymph nodes were effective, and then sought to see or identify how, for example, white blood cells, how white blood cells in particular would cause a sense of stimuli or reaction as part of early investigations by Hanseni in around 1936, and it was from there um, uh, it was from there the sort of in sort of early research by Hanseni and the general adaptation syndrome, general adaptation syndrome was sort of coined, and at the same time the sort of early workings in around from a physiological basis, the fight and flight sort of response. Following on from Hanseni's general adaptation syndrome in 1936, there was works by George Solomon and Rudolf Moose between 1964 and 1969, where following Sally's general adaptation syndrome in 1936, Solomon and Moose sought to investigate emotions, immunity, and disease through the central nervous system to understand stress and coping. And these investigators looked at the production of autoantibody, for example, in a rheumatoid arthritis model, to understand immunological basis, especially autoimmunity and disturbances with psychology. And the major theoretical point was autoimmunity may be related or regarded to relative increase in immunological components. These the increase might be related, or where there was where the from an immunological basis where uh, where um, where where the immune system is affected in related in regard to in regard to coping, or an emotional effect associated with an elevation of adrenal steroid hormones, um, and this then and thereafter from George Solomon Rudolph Moore's work from between 1964 and 1969 followed in around sorry in the same sort of duration works by Lazarus also sought to identify sort of coping from early works in 1966, from works in around harm, threat, and challenge. So Richard Lazarus's theory from 1966 had drawn on a distinction between three kinds of stress: harm, number one, harm; number two, threat; and number three, challenge. And around this, number one, harm tends to refer to psychological damage that may have already been done. Number two, threat, is where Lazarus had documented sort of anticipation of that of a threat that has not yet taken place but imminent. And three, challenge, is where Lazarus had documented in works where this results from a difficult or challenging demands that that an individual may feel may feel confident about overcoming by effectively mobilizing and deploying coping based resources. In around this time, in around Lazarus's work, sort of subsequently, works by George Engel, and the biopsychosocial model, the biopsychosocial model, had been part of particular and specific areas of clinical and medical practices where George Engel developed the biopsychosocial model where this looked at, for example, aspects of spirituality, and the mind, and the body, and how the three sort of entities sort of are connected, so the works by George Engel in 1977 had delved into sort of understanding coping from three main perspectives in around 1977, and following on from there, works by Folkman and Lazarus in around 1980 and 1985, and sort of up to sort of 1997, where Folkman and Lazarus look at sort of look at works in context of coping aligned to positive emotions. And so there had been sort of evidence, or substantial evidence, that positive emotions are a normative aspect of the coping process, and that they help restore physiological and psychological coping resources. Less had been known about the full range of coping resources, including content, timing, and duration, which are associated with regulation of positive as opposed to negative emotions. Evidence does suggest that underlying beliefs, values, goals, and are implicated in and part of coping processes. So in line to sort of Lazarus's harm, threat, and challenge, George Engel's sort of biopsychosocial model, and Folkman's Lazarus positive emotions works. There then followed works where researchers, investigators look at a concept that has been referred into the literature as the psychoneuroimmunology concept, or P&I concept. And the P&I concept is in sort of a blunt way is similar to the works of George Engel's biopsychosocial model from 1977. However, what the psychoneuroimmunology concept encases is where there's the nervous system, sort of perspective, there's the immune system perspective, and then there's the endocrine system perspective, and then centrally sort of between in around those sort of entities, there is then the link between health and disease, and how health and disease can be compromised, can be compromised in context of being more favorable around individuals who for example are able to draw upon particular coping resources, versus those who, for example, are in ill health and may find it challenging to draw upon sort of coping resources. So the P&I concept has a various has been sort of documented and highlighted in the literature from various perspectives, and there are papers that have delved into discussions and investigations at looking at the sort of the inter sort of associations between the nervous system, the immune system, and endocrine system, and a context of health and disease as well. And then as part of this, then followed another basis that had been referred to as the diathesis stress model. The diathesis stress model, and this model takes into consideration both predisposing characteristics of individuals and an instigating event. This model propose this model sort of put this model sort of suggests that has basis in around an impact of initiating a sort of event that is perhaps more likely to contribute to a disability or chronic illness in those who interpret symptoms, for example, as indicative of serious problems. So activities that increase pain, activities that increase pain tend to be or can be avoided. At the same time, these sort of at-risk people believe that all activities that cause increased symptoms or those that are anticipated to those cause injury should be avoided. And at the same time, the diathesis stress model can be used to sort of integrate factors to coping in context of chronic in around chronic diseases, for example, and again in around for example in around chronic kidney disease. So in the original works that had been presented at the Excellence in Paediatrics in 2010, there had been a hypothetical model of coping that had been suggested by the lead one of the lead authors in this works, and where for example at the bottom of a pyramid, for example, you have for example coping, and where coping draws upon sort of psychological and physiological resources, and where in the middle of a pyramid. So in the middle of a pyramid, pyramid, the if the hypothetical model in around coping suggests that, for example, if individuals are able to draw upon psychological and physiological resources in around coping, that then allows them or propagates a sort of a sense of well-being. And then if there's a sense of coping and a sense of well-being at the top of the pyramid, therefore therefore individuals in around this in context of a hypothetical model of coping, and that had been suggested in this works sort of retrospectively in 2010, at the top of the pyramid therefore would sort of propagates a basis in around where individuals have can therefore then have a sort of a decent QOL, or quality of life. So again, this was works that was that had been sort of retrospectively sort of highlighted, and where this hypothetical model of of coping looks at sort of coping from again, psychological and physiological basis, and aligned to the question, now, which was which again was is in around coping, is this the foundation of well-being? So quite clearly or transparently, coping calls for a deeper and more intricate understanding, especially in children and young people whom are or can face chronic illnesses such as chronic kidney disease or CKD. And to understand coping, models and theories require further exploration and scrutinizing respectively. And at the same time, this works that have been presented in around at the Excellence in Paediatrics in 2010, had identified that there are no official sort of coping models, and the foundation behind a good the foundation of behind a good well-being and quality of life is coping. And so thus to conclude, the authors had highlighted the mind is the mind is beautiful, but so is the body, and therefore and again so that draws an end to this particular basis around and around this sort of overview as part of this part of the Labonyx Bltztorm. This has been an overview as part of the Labonyx Bltztorm, and a part of the Bostix news, and part of an editorial edition, and a path slide, and a cavalcade, and once again another Storm Bostix production. Thank you.